Gardner, and Melinda is a renowned expert. So I'm supposed to read this area, but I'm not gonna read it all for you. And she's a resident expert in the North Texas Area Agency on Aging. She's been working in this field for multiple decades. She is an expert in Medicare benefits, Social Security, and she loves questions. We have talked for the last 15-20 minutes. Rhonda met her at not Park Cities, but at Prestonwood Baptist, and saw her handle a program there, which was outstanding, and that's how we come to bring Melinda to here. So a little warm welcome for Melinda. And whenever you want me to pass out things, let me know.
Thank you, thank you, thank you. Thank you all for being here today. It is so good that we have more than one person. I mean, I've been to presentations and I've had one person, but that's okay. They were educated, so that's what I'm here for, to educate you about Medicare mainly, but also give you a little bit of information about Social Security. I know it's the end of the day. Some of you probably work today, so are you tired? A little bit? Could it be because you just went through 31 days of March? 31 days March?
Quite a hike.
That's a good one. Yes, yes. All right. Well, let's go ahead and get started. As he mentioned, my name is Melinda Gardner. I have been a benefits counselor with the North Central Texas Area Agency on Aging. Now, there's a North Texas Area Agency on Aging, but we are North Central Texas because we are center. If you think of Tarrant and you think of Dallas, which is where we're at now, we cover the counties surrounding Dallas and Tarrant. So I asked Dallas if they would be able to do this presentation. They said no. I said great, then I'm there. So you got me today. All right. All right, so we are known as the SHIP. Anybody heard of SHIP before? Nobody's heard of a SHIP? All right, SHIP is the State Health Insurance Assistance Program. And see, I think all of you are so young, you probably don't have a Medicare handbook yet. So you would not know about SHIP, but on the back of the Medicare and You handbook, it says HICAP, which is the name for Texas SHIP. And if I pull out this book, it says SHIP for Texas right on the back. So once you reach the age of maturity for Medicare, then you'll have this book. If you need one, I do have a few with me as well. So we are considered the State Health Insurance Assistance Program. There are a total of 254 counties in Texas that are covered by SHIP. There are 28 SHIPs in Texas, so we are all over. Anytime you call Medicare, guess what? Guess where they refer you? They don't answer the questions, they send you to us. So we get educated, we get trained continuously on Medicare and Social Security. We also partner with the SMP, which is the Texas Senior Medicare Patrol. Why? They handle fraud and abuse. Now, nobody's probably experienced that before, right? Nobody's heard of those phone calls or, those extra things on a Medicare summary notice, those types of things. Fraud and abuse happens. So we have to be more aware of what it takes in order to protect ourselves. So I'm gonna give a little bit of information on that as well. And this is our benefits counseling team. There's only 4 of us and we cover 14 counties. That's a lot. But I'm gonna give you a chance to help us out if you'd like. Okay, so the SHIPs provide unbiased information. We do not steer you towards a particular plan. We do not tell you what to do. We provide unbiased information. And so you make that decision based on what we provide to you. And the information will be kept confidential. We do not share it with other agencies. And we do have a reporting system because our funds come from Health and Human Services. so we do have to report to them. We can help a Medicare beneficiary, we can help their family member, if they have a caregiver, or even if they have a friend that's helping them out, we can provide information. SHIPS can help you understand costs and coverage. We can also help with comparing options, and we're gonna talk a little bit more about that. If you need help enrolling in a plan, we can help you with that, or if you have some issues with billing from your insurance, or if you have denials, we can kind of guide you to help you get through that. As I mentioned, SHIPS are everywhere. There are 54 SHIPS in the United States. There are 2,200 local programs and 15,000 counselors. That number probably has gone up by now, but there are a lot, and we have educated over 7 million individuals. And we have held over 2 million counseling sessions. We do have on-site clinics in our counties, usually Denton County, Collin County, Hood County. I think those are the 3 counties. We're working on getting a on-site clinic in Johnson County. And so if you live in one of those counties, you can actually get help face-to-face for any questions you have. All right, so this flyer, which you will get in your goodie bag at the end, this provides information on all the programs that the Area Agency on Aging offers. How many of you heard of Meals on Wheels? Oh, all right. Congregate meals? No? Okay, so at a senior center where they serve meals sometimes, that's considered a congregate meal. So we provide the funding to help companies or agencies within our 14 counties provide those services. So that's one of the big ones that we have, the congregate meals and the Meals on Wheels. And of course, there are volunteers that distribute those meals. We also, you all had a presentation last week on Alzheimer's. And we do have a dementia care program, and we have individuals who help with that, provide resources, and we provide that in English and Spanish. Another initiative of ours is the Aging and Disability Resource Center, or ADRC. The Area Agency on Aging, we want as a one-stop shop. So if you're not sure where to go, what to do, you can call us and we can assist. The ADRC can help people of any age. If they're looking for rent assistance, if they're looking for utilities, if they're looking for housing, we can provide resources that will help individuals within their county find what they're looking for. So if somebody calls us, there is somewhere that we can assist in some way. That's what I love about us. Now, these are program opportunities if you are looking for something to do. We have volunteer opportunities. I'm in the benefits counseling program and the senior Medicare patrol. We also have long-term care ombudsmen who advocate for individuals in the nursing facility and assisted living facilities. And then we also have evidence-based workshops, chronic disease self-management, diabetes self-management, fall prevention, Tai Chi, all those are evidence-based programs that we offer within the communities. And our volunteer opportunities allow you to choose where and how you actually serve. So if you're interested and have the time, feel free to reach out to me to get more information. So today we are here to talk about Medicare. Medicare is federal government insurance. So if you have worked 10 years, then you are eligible for Medicare. If you don't have those 10 years, then you could pay more for your Medicare. So let's look at what our objectives are for today. So we're gonna look at what Medicare is. We're gonna look at the options that we have. We're gonna talk about the assistance programs, talk a little bit about fraud and abuse, and marketing do's and don'ts. Now let's look at, some questions. You can enroll in Medicare whenever you want. True or false? False. Ooh, all right. I had asked Keith if he wanted to do this presentation because he said he likes to read. So maybe somebody else can help.
You don't want Keith doing it.
We got a public speaker in the back of the room. So.
Uh-oh, I may have to call him up. All right, that is false. There are rules for each type of enrollment period, and you have to have an enrollment period in order to switch, and there has to be an enrollment period when you first sign up. So you have to make sure and enroll during those times. Medicare costs the same for everyone.
False.
False. Ooh, gosh, I love this group. That is false. The exact amount you pay depends on the type of plan you have or the coverage you have. All right, one more. Medicare covers everything.
False.
Wow, that was a loud one. Some people have been through some things. That is false. Medicare Parts A and B does not cover everything, and it doesn't cover dental, vision, or hearing. So here is a little chart that shows what your options are. And for those of you that may be on Medicare, on page 10 in the Medicare and You handbook, it shows you what your options are. So it does provide that information, and then it breaks it down and gives you the page number where you can find more information. So Part A is hospital coverage, Part B is medical. And then you can get a Medigap policy. Medigap covers the gaps in Medicare, so if Medicare pays something, then the Medigap policy will pay. And then, in order to have prescription drug coverage, you would sign up for a standalone Part D. We're gonna get more into that. So original Medicare is one option. Medicare Advantage is the second option. Medicare Advantage are through private insurance companies that contract with Medicare. So it doesn't become a supplement, it becomes your insurance. You no longer utilize the Medicare insurance. And we're gonna talk more about that. And then it may include some additional benefits, such as dental, vision, and hearing that Medicare does not cover. And usually it covers prescriptions. So if we look at original Medicare, as I mentioned, Part A is hospital insurance, and there are certain things, of course, that it covers. It will cover inpatient care in the hospital. It will cover skilled nursing facility care, also hospice care and home health care. Now, those are the things covered under Part A. Usually, there are some out-of-pocket costs with that as far as the hospital is concerned. Do you mind?
Oh.
Now, what he's passing out are the costs associated with Medicare if you do not have any other coverage, okay? So keep that in mind. And while he's passing that out, I'll go through the Part B insurance coverage. So Part B will cover your doctor visits, any tests, any x-rays that you have, outpatient care. It will also cover home health care, even though it's covered under Part A, it also is covered under Part B. If you have need of durable medical equipment, it covers that under Part B. And then preventive services. That is something that Medicare started several years ago, where preventive services do not require a copay. So when you go to your doctor for a preventive service, make sure they're aware that you're there for that preventive service. Because if you start saying, oh, I have an earache or I have knee pain, it turns into an office visit. And so you're going to pay for that office visit. So you can either just do the preventive visit and then go back for your office visit, or they charge you for that office visit at that time.
Can I ask a question?
Yes.
So under Part A, are there different aspects of hospice care? So it's not just end of life, it's just, isn't there another path under hospice that's
like comfort and care?
Palliative care.
There's palliative care versus hospice care. So that's a little different.
And that's still underneath the Medicare program?
Yes, yes. It will cover palliative care. Under Part A.
Would chemo infusions fall in here somewhere?
Part B, that's covered under Part B. Normally, that's handled outside of the hospital, so then that's covered under Part B. So for the most part, Part B covers everything outside of the hospital, including the emergency room. And then Part A covers when a person is admitted into the hospital. So looking at your sheet, it has the different costs associated with Part A and Part B. So Part A, you have a deductible of $1,736. If you go into the hospital for a day, for a week, for a month, for 2 months even, that's your deductible for that visit. Once you're out of the hospital for 60 days and then you go back in, you pay another deductible. So it's not annual, it's pretty much each time you go into the hospital. Now, that's for the hospitalization. When you're in the hospital, who do you see? Doctors, nurses. So guess what? That's still going to be charged under Part B. So you still will have that, whatever amount that you pay for that visit, for that test, or whatever it may be, okay?
Question.
Yes.
I don't know if you're gonna cover this, but I'm working, 65. I have just standard insurance through the company. Do I go ahead? I've had people tell me you should get A, I've had people tell me you shouldn't get
How much, well, I'm not asking you to answer this question, but you have to look at how much you're paying out of pocket right now just for your insurance.
A. Okay.
And if you'd like to talk later, I'm happy to do that.
It's the same question several of us have.
Mhm.
I'm 65 and I'm not gonna retire for a while, and I've got great coverage. And what I pay for that is a lot less than what Medicare would cost.
Okay,
So I've been told by some people, oh, then you don't have to do anything until you retire, and at that point, you have a certain window, like 60 days, in order to sign up to transition. But I've had other people tell me, oh no, you have to register now when you're 65. And so I've had advisors on both sides with both opinions, and I don't have a clear direction yet.
okay, so.
I'm trying to help you.
So if you are still working and you work for a large employer, you do not have to sign up for Medicare. Because if you're not paying a lot out of pocket, why pay extra $202.90 per month if you're not gonna use that insurance? Because Medicare would be secondary. And so once your primary paid, is there anything left for the secondary to pay? So that is something you have to weigh out. Some people actually pay more or maybe have a high deductible employer plan, and so therefore it may benefit them to sign up for Medicare. So it really depends on a person's situation. But if it's very little out of pocket, no need. You will not be penalized. You have an 8-month window once you stop working to get Part B. You can sign up for A anytime because it's usually free. You have 8-month window to get Part B, but you only have 2 months to get prescription drug coverage. So there's those caveats that, you know, people aren't aware of, that sometimes they're not doing the right thing in the right amount of time.
So you're siding on the viewpoint of there's no need to register anything until I retire.
I'm not siding on
You
any
didn't-
viewpoint.
you didn't-
You're not-
I provide unbiased information.
But you believe that is the correct answer?
That is the correct answer.
I like that. That confirms what I thought.
I did wanna point out another thing though, if you're contributing to HSA and wanna
That's
continue,
what I was just about to say.
you should not sign up.
I've heard that
Exactly.
too. That's what I
If
heard.
you are contributing to an HSA, then you could be penalized if you sign up for Part A.
Stay away from it, is what I heard. Okay.
Yeah, but if you are contributing and you have a spouse, then you can still contribute because
Right.
it's, yeah.
Complicated.
It's complicated.
Thank you.
You're very welcome. All right, any other questions before we move on?
So Part A doesn't cost anything.
If you have that 10 years of work history, correct? Mhm.
just something I learned recently with my mom. She was in the hospital, and they wanted to make sure she was in there for 3 days.
3 midnights.
3 midnights.
Correct.
To go to
Before she
rehab.
got transferred to skilled nursing, otherwise, then it wouldn't
It's
have
not
been
covered.
covered.
That's right.
That is
And the
correct.
hospital actually worked with us to keep her there an extra midnight.
Yeah.
And I didn't know that rule existed, but somebody else did that helped
Yes,
us.
for original Medicare, you do have to have 3 midnight stay. You have to be admitted. You can't be in observation, you have to be admitted into the hospital, a 3 midnight stay, and then you're eligible for rehabilitation. But, so yes, you do have to have that. Now, with the Advantage plan, some of them may not require a 3 midnight stay. They may say, okay, if somebody's in there for 2 days, they may approve them going to rehab. So it really depends on the insurance. But I always tell people, 3 midnights, that way you're for sure covered. So Advantage plans, sometimes they have, they get a bad rap. Well, 60% of Medicare beneficiaries are on Advantage plans. And so they're becoming more popular because they have those extra benefits. A lot of times people are looking for dental, vision, or hearing, and so they have some of those benefits. They work, that's all I can say, they do work. So if we look at Medicare Advantage, it includes all benefits and services covered by Part A and Part B. As I mentioned, they're run by private insurance companies, just like the Part D, the standalone Part D. And they have to follow Medicare rules. I actually had a client who called and said that they were not able to get rehab. They were denied rehab because they had a certain Advantage plan that, only covered, heart or, something else, and the hospitalization wasn't regarding that. And I thought, I have not heard of that before. Now, the plan itself was specific, but yet they follow Medicare rules. So they had to actually approve that rehab. But yet somebody at the company said, no, that's not gonna be approved. So, okay, where is that in writing? Show me, what you're talking about. And that's usually what I tell people, make sure you're asking those questions, because they're not always accurate in what they provide, but it should be listed in the handbook.
Melinda, real quick, do you have to have certain doctors also approved by Advantage?
They have to be in network,
That's,
yes,
Yeah.
they have to be in network. Now, some plans do allow you to go outside the network, but you do could pay a higher cost for that. Mhm.
so regular Medicare, you don't.
No, that's federal insurance,
So you
so
can choose any doctor, but in Advantage,
Advantage is different, yes.
So Advantage is like an
Advantage.
HMO?
HMO and PPO type plans, yes. Mhm.
The Advantage plans are gonna look essentially very similar to what you've had as an active employee.
Right. Exactly,
Feel much more like.
yes, with some exceptions.
yeah.
All right, and as I mentioned before, Medicare Advantage has extra benefits that they cover. Sometimes they'll cover transportation as well, they'll cover fitness benefits. The great thing that Medicare has done this year is that now you can put your providers in, on the Medicare.gov website and be able to search to see what plans they accept. So that's the great thing that, they've changed for this year. Yes, sir.
I believe I've heard that even though that Medicare lets you go anywhere, that not every doctor will accept.
That is correct. That is correct. Some doctors have opted out. And if you pay that doctor and then you submit the claim to Medicare, that doesn't mean they're gonna pay the full amount. So you have to be mindful of that.
Do spouses have to choose the same, or can go individual? And
It's
is there
individual.
advantages or disadvantages to choosing a different path? One wants Medicare, one.
It's individual, so it's really up to that person. and what type of benefits they're looking for, and then also their health situation. Yeah, it really depends on that. So if somebody says, well, this is what I want, and so my wife needs to be, or my husband needs to be on this one, it may not be beneficial.
It seems like if you're sicker, you wanna be on just straight Medicare. And if you don't have any health problems, the Advantage might be a little better.
I would not necessarily say that, because Advantage plans have a maximum out of pocket. So if there's a maximum out of pocket, then it may not cost you anymore. So it depends.
Where does transportation, like if you call an ambulance for someone that's on Medicare, where does that fall out?
An ambulance is under
Ambulance
Part B.
services.
Ambulance services under Part B. Transportation that the Advantage plans offer are like to doctor's appointments.
Okay.
Some of them will provide that. Any other questions? All right. Okay, so this, next few slides talk about, you know, what to look for when you're, comparing Medicare Advantage. First of all, you have to make sure your doctors are in network. Okay, make sure, even though online it may say that they're in network, it's still a good idea to contact that doctor's office and make sure that they accept whatever plan you're looking at or whatever company you're looking at, because that's not always, something that people do. So, you have to look at the annual maximum out-of-pocket cost. I think the lowest one this year is $3,400. So if you divide that by 12, I don't remember how much, anybody, mathematicians? Okay, under $300. So sometimes if you look at Medigap policies, they may be more than $300 a month. So it just really depends on a person's situation and whether they can afford the Medigap plans versus the Medicare Advantage. The service area, you do have to take a look at that for Medicare Advantage. Whether doctors and hospitals are in network. The rules that you have to follow. Make sure you're looking at that handbook to make sure you're following the rules and see what you need to do to make sure things are covered. And what additional benefits are offered. The star ratings. If you are looking at an Advantage plan, on the Medicare.gov website, there are star ratings that shows how those plans are rated. That's based on individuals, that's based on, I think it was like 50 or 55 different topics in order to come up with that star rating. Okay, so prescription drug coverage, making sure your plan has prescription drug coverage. If you sign up for a Medicare Advantage plan and it does not have prescription drug coverage, you cannot sign up for a separate standalone plan. So it has to be one included with that Advantage plan. You cannot have a Medigap policy and a Medicare Advantage plan at the same time. They will not work together. And it is illegal for someone to sell you a Medigap policy if you have an Advantage plan. I've had several calls where people say, well, I have an Advantage plan and I have a Medigap policy. And so then we kind of have to go through and see what happened. Most of them, they told the agent or broker that they were gonna cancel their Advantage plan. So then they have a right to sell that to them. If you have a Medicare, original Medicare and a Medigap and are considering switching, know that you will lose your Medigap as well. It will not pay anything. So make sure you are checking out what you need to do in order to cancel that Medigap policy and get a Medicare Advantage. Medigap does not automatically cancel if you get a Medicare Advantage plan.
Question.
Yes.
Is this an annual decision that you can make? In other words,
Yes.
it sounds like you can do A, B, GAP, and D, or you can do C as options, but you can change that decision the next year?
Every year, October 15th through December 2nd.
So just like that's a
And if you don't
Yeah.
make it, if you don't make,
Nope.
if you don't make that election, it just rolls.
And then try to go back to.
Yes, unless you receive a correspondence that sometimes the Medigap policies are, they may terminate for some reason, move out of the area. The only time a Medigap policy can be canceled for an individual is if they don't pay. That's the only time.
Is Medigap deducted from the Social Security?
No. You have to pay that directly.
So what comes out of Social Security?
The Part B premium,
Part B
the
premium.
Medicare Advantage plan, if there's a premium, and or the prescription drug plan premium. That all can come out of
Okay.
the Social Security benefit. Good questions.
But does it come out of your social security benefit if you're not taking social security?
No, then you have to pay it quarterly.
Okay, so it's only if you're taking your
Correct.
social security benefit that you would utilize that within the Medicare.
Yes, correct. So if you're not collecting Social Security, they will send you a statement quarterly, or you can set up automatic draft from the Medicare.gov website and pay it, monthly. Mhm.
Melinda,
Yes,
isn't it also true that if you sign up for a Medicare Advantage plan, you're still paying your Part B premium?
that is correct, because the Advantage plans actually get the Part B premium. So that's why they don't have a high premium, or no premium most of the time. But I think, they're actually listed in the back of the book, and I think the highest one is about $100 and some. I have not heard of anyone, $182 for Medicare Advantage premium. I have not heard of anyone, signing up for those, but hey, it's there.
I, was in another session recently that was saying if you sign up for Social Security, then you'll be automatically signed up for Medicare.
No,
No, is there a way to
Well,
opt out of that, or
the big,
you know, to make sure, cause the HSA problem, you know?
okay, that is correct. If you're signed up if you're signed up for Social Security, they will automatically send you your red, white, and blue card. So once they send you that red, white, and blue card, then you can send it back if you're not ready to start Medicare. So yeah, that is correct, they do. But if you're not on Social Security and you're still working, you don't have to do anything. Yes,
I'm a Navy vet, and I can get my medications through the VA. Does that change what I would pick, or, cause I don't need I don't need the prescription benefit of it.
thank you for your service. It depends, because I know I've received calls from, veterans, and they get a Part D standalone prescription drug plan as a backup. So it just really depends. Sometimes they'll sign up for a Medicare Advantage plan that doesn't have a monthly premium, so they have that as a backup. So it's a personal choice. All right,
Did you say you could do an Advantage plan and Part D together?
they come together, but if you do an Advantage plan without Part D, you cannot sign up for a standalone. How are we with time?
Yeah, I was gonna ask, do you want us to hold questions to the end, or are we doing okay?
We still have 25 minutes, 20,
Yeah.
okay, all right, we're good.
Okay.
We're good, okay, so, we've been talking about the Medicare supplement insurance. I said it covers the gaps in original Medicare, and it cannot work with Medicare Advantage. So, we've already talked about that. And Medigap, private insurance companies, just like Medicare Advantage. Now, I know this chart is,
Looks like an eye test.
just, yeah. Just think about when we were maybe 20 years old. You'd be able to read that, right? Well, this chart is actually on page 76 in the Medicare New Handbook. You can actually find the standardized Medigap policies and what they cover. So, for instance, Plan F, that used to be the most popular, but of course, they kind of stopped that for people who were not 65 as of 2020. And that covered everything. Once you pay that Medigap premium, you didn't have any other out-of-pocket costs for your medical. Sounds good, right? Well, some people right now are probably paying $400, $500, $600 for that policy, because a lot of people cannot get that policy because they stopped selling it. So of course the premiums were increased. Now the most popular plan is G, and G covers everything except the Part B premium, which is $283 this year. And that is an annual premium. So it's not like the Part A deductible, annual deductible. It's not like the Part A deductible, but it is annual deductible for Part B. Any questions on Medigap? It's kind of straight.
Is that, who do you buy that from?
I'm sorry?
Who do you buy Medigap from?
Private insurance companies. All right, and we kind of already talked about creditable drug coverage, so we're gonna go into prescription drugs. Now, coverage that's expected to pay on average as good as Medicare. That's the standard drug coverage. So if someone has employer coverage, they can get a letter from their employer saying, okay, I have this coverage and it is creditable. That's what they will tell you. Even retiree coverage, prescription is creditable. Medical is not. So if you retire from a company who offers you a plan, usually HMO or PPO, that's not creditable. So you would have to sign up for Medicare in order to utilize that. Because they will pay at 20%, not 80%.
I didn't follow that.
So if you have a retiree plan and you decide not to sign up for Medicare, that retiree plan is going to pay secondary.
The retiree plan after you retire from your company?
Yes.
Got it.
Yes. Mhm. And so you want to make sure that you have that coverage under Medicare, because they will pay the 80%. And then your retiree coverage acts as your secondary.
As you're retiring, are there windows, like, I'm turning 65 in April, let's say I retire in August. Is there a specific time that, do I wait then until October 15th or December 7th
Oh,
to
no,
sign
no.
up?
No, no.
What should I,
That would be your initial enrollment period or a special enrollment period, because you work past 65.
okay.
So you wanna make sure that you have a, letter from your employer saying you had coverage from this time to this time.
Okay.
And then they say usually start 3 months before in order to make sure everything's in order, so that when you sign up, it can start on the day you want it to start.
That's assuming that the company tells you 3 months before.
Well,
Many people may just
right.
get pink
Yeah.
slip. And
Yeah.
That's true,
Yeah.
that's
So
true.
at that point, you have, I think I heard you say
Yeah.
60 days to get the
For prescription
for
drug
prescription
coverage, but you have
and a
8
longer
months.
period for the other. But
Yes.
the clock starts on the day you're terminated.
The day
Okay.
your coverage stops.
The day my coverage stops,
Same
but
thing.
I don't necessarily have to sign up within a certain time frame of turning 65. It's really driven
There's
by my
triggers.
coverage,
Correct,
Okay.
that is correct, by your employer coverage,
my employer coverage.
not retiree coverage, but employer coverage.
How would
And-
Cobra, sorry.
No, go ahead.
How would Cobra factor into that?
That's what I was just.
Good question.
Great question.
Good question.
So, companies usually provide COBRA for 8 months, sometimes longer, but COBRA is not creditable.
Right.
So therefore, if you decide to take COBRA, maybe because the company's paying for it, why not? Then you can stay on COBRA, but if you're eligible for Medicare, you should make sure and get started with that process. Because if you go past those 8 months, then you would be penalized. So, yes, but COBRA, most of the time, if you have to pay for it, Medicare is gonna be less expensive. But if you're able to get it from your employer, then that's great. We talked about what prescription drug coverage is, and the 2 ways to get prescription drug coverage, either a standalone prescription drug plan or a Medicare Advantage plan. Those are the 2 options. And you have to look at the cost and the coverage. There are tiers that the prescriptions are on, And because it's on one tier with one company, doesn't mean it's gonna be on the same tier with another. So it's a good idea to review that, and anybody can review that information on Medicare.gov. You don't have to have Medicare, you don't have to have an account, you can just, go onto the website, use the plan finder, which we're gonna, go into in a little bit. Now here is a, chart that kind of shows what the prescription drug plans, the cost for that. The Texas low income subsidy premium amount, the $4.82 up there in the middle, that dropped. It was like 30-some dollars in previous years, so I'm not sure what's going on there, but what that means is if someone is eligible for extra help, which is a program through Social Security to help reduce the cost of prescriptions, if there's a plan that's $4.82 or less, then that plan is gonna cost $0 for that individual. So they get a break on the premium as well as the prescription cost. And here's another handout. There. Thank you. So the sheet that is being passed out kind of gives you a summary of the different programs that are available. And since I was talking about this here, I thought I'd go ahead and pass that out now. It shows that if someone's on supplemental security income, what the income limit is for that. It shows the Medicare savings programs, what the income limits are for those. And then it shows extra help as well as the Star Plus or nursing home Medicaid. So those are different programs that we can help people understand more and help them apply. If you're on a Part D prescription drug plan, you probably have noticed that the deductible has gone up from last year, $590 to $615. And what I've noticed is that more plans are having a deductible. Previous years, not every plan had a deductible, but starting this year, they are having a deductible for those plans. Now, the good thing that has happened also is that they have reduced the cost of the total out-of-pocket cost for prescriptions. Yay. Before this year, or before last year, because it started last year, individuals sometimes had to pay up to $7,000 and $8,000 for prescriptions. That's ridiculous. I mean, I don't see how people can do that. And so, starting last year, the amount that was the maximum out-of-pocket for prescriptions went to $2,000. That's for anyone. So a person would pay no more than $2,000. This year, it's up to $2,100. So I'm sure it's gonna creep up. But it is reduced. That's the good thing.
Couple of questions. One, if you have a condition where they prescribe you 3 or 4 different drugs for the same condition, does each of the prescription type apply to the deductible? So would that be 8,000?
The maximum you pay is $20.
No matter how many different types?
No matter how many.
And then the other thing you sometimes run across with private insurance is that they try to tell you that even though the doctor prescribes you a certain medication, that they won't cover that medication. How does Medicare deal with that particular issue?
Medicare, sometimes you have to use step therapy in order to get that medication. But if the doctor can write, can note that we've already tried that doesn't work for them, then a person would be able to get the medication that's needed. And sometimes there are exceptions that can be made.
Okay, what kind of therapy?
Step therapy, so that way you start with a generic, but if generic doesn't work, then you can go to the next one. One of the things that Medicare also did is negotiate pricing for certain prescriptions that were way a lot out of pocket. And I have worked with several people on the Eliquis. In 2024, the Eliquis was $200 and some dollars a month. This year, the individual I've been working with is able to get it for $47 a month. So it is like totally different. And I think the retail cost is probably over $800 for that medication. So Medicare has negotiated pricing for certain medications, and next year there's gonna be more medications, and I think in 2028, there's another set of medications that they're negotiating pricing for. So it's a good thing, because that does reduce the cost, and the fact that the $2,100 out of pocket is set. Now with prescription drug coverage, there are some things that you should also take into account. You have to look to see if all your prescriptions are covered. They may not cover certain ones, they may cover something similar, but not necessarily certain ones. So it's always good to check to see which ones are covered.
So I've got top that one. The drug price is X amount, say it's $80. I get out my Good RX card and it's $35. Can I use my Good RX?
That depends, because sometimes the assistance programs, if you have government insurance, it won't allow you to use it. So it really depends. Mm-hmm.
Good question.
Yes. Sometimes there are restrictions on prescriptions, prior authorization. I mentioned step therapy, or even quantity limits. Sometimes they will limit how much of the prescription you can get in a 30-day versus a 90-day. You may not be able to get it in a 90-day supply. How much the premiums are and the annual deductible, and then how much you'll pay for co-insurance at the pharmacy. So those are the types of things that you should look at when you are considering prescription drug coverage. And they also have star ratings. So those you can look at on the Medicare.gov website. Mail order, a lot of times, is less expensive, but not necessarily. So make sure you're checking whether the pharmacy is in-network, whether it's a preferred pharmacy or out-of-network pharmacy, because that does affect pricing. Sometimes you think preferred pharmacies, oh yeah, that's gonna be the least expensive, but not necessarily. I've ran across some when I've done comparisons, preferred pharmacies was still more than a network pharmacy. So make sure you're checking those prescriptions.
It's just a generic question, is like Walgreens and CVS, all of those nationally are all preferred?
No,
Or is
not, it
is
depends
that-
on the plan.
And the plan in the state level?
The plan contracts with, the pharmacy. Now, if you're out of state and you wanna get that prescription, yes, it would be the same price if you're using CVS or Walgreens.
So like if I was having it prescribed at CVS or Walgreens in Arizona, cause I was traveling, same as if I was here?
Yes, yes. Mhm. But if you use CVS and then you try to go to Walgreens, it could be a different price.
Right, right.
And are generally independent pharmacies not, or does it just vary?
It varies, it varies.
You just have to call them, like a Doherty's, you know?
You can look on the Medicare.gov website and you're able to put in that pharmacy to see if it's in network or if it is out of network or if it's preferred. Now, there is sometimes an additional Part D premium, just like with Part B, if someone has a higher income and they look at 2 years prior. So for 2026, they're looking at 2024, maybe somebody was working in 2024, now they're retired, but 2024 was a higher income. So they could be subject to the income-related monthly adjustment amount, which adds additional amount to the premium. So on your handout, the first handout that you received, at the bottom, it does show what that IRMA is for Part B as in boy. And this is what the IRMA would look like for Part D, the income-related monthly adjustment amount. So it's adding an additional amount to your premium. The only other way that you could have a higher premium is if you did not enroll in a Part D plan when you were eligible. So if you go 5 months, say you retired, and then you went 5 months without coverage, well, the time frame says you have to have it within 2 months. So you're 3 months out, 5 months, 3 months out, and you don't have an enrollment period. So now you have to wait until the fall to enroll in that prescription drug plan. So those are additional months without coverage. So it's 1% per month for each month that you are eligible that you get penalized, but then the IRMA would be a separate amount if your income was higher. All right, the Medicare prescription payment plan. If you have and this is where I've seen it used, if you have a deductible, the $615 deductible, so you go to the pharmacy, pick up your prescriptions, and they say, okay, that'll be $800. Like, whoa, I wasn't planning on spending that much. You can opt into the Medicare prescription payment plan, which will spread out your costs throughout the year. Anybody can sign up for that. If you don't have high prescription costs, it may not be worth it for you. But this allows you to spread that cost throughout the year and be able to pick up your prescriptions at the pharmacy, and you actually pay the insurance company, not the pharmacy. And this actually started in 2025, where they were able to allow people to do that. And it's helped. People have called me and actually said it helps. I mentioned the Extra Help. This is a program to help people with limited income and resources. It's listed on your resource sheet there, and it shows what the income and resource limit is. 2015 for an individual, 2725 for a couple, and then the resource limit, 18,090, 36,100 for a couple. So if you have Extra Help, then you are able to switch plans every month. So that's the good thing about having Extra Help. So the first 3 quarters of the year, if you decide to switch, here it is April 1st, then your plan could start May 1st. During open enrollment, October 15th through December 7th, then you would only use that period and it would start January 1st. Okay, so it's not like it would start the next month like it would the first 3 quarters. And the last, not the very last, but the Medicare Savings Program, which is listed on your resource sheet, is a program to help pay the Medicare premium. You do have to have limited income and resources, and you will get a copy of this presentation in order to show you what is considered income, what is considered resources. I have talked about the Medicare.gov website, and that is the perfect place to get your Medicare information. When you go to other sites, then they get your contact information, you start getting phone calls or emails, things like that. So it's good to use Medicare.gov. And there is a plan finder on there where you can search for plans. Depending on what you're looking for, you can do Advantage plans, you can do prescription drug plans, and you can do Medigap policies, all on that website. And because Medicare is so confusing, there's always fraud that we have to watch out for. So that's why it's good to know about these options and what your options are when you're looking at Medicare. Original Medicare, whether it be a prescription drug plan, Advantage plan, or a Medicare supplement or Medigap policy. And marketers are, you have to protect yourself from marketers, and so there's some do's and don'ts in order to reduce fraud. This is a do's and don't from the Center for Medicare and Medicaid Services that you can actually keep so that you know what they're allowed to do. Sometimes brokers or agents may not be aware of what they're doing because it's the company telling them what to do. So just make sure you are aware when you are talking to brokers or agents. We talked about open enrollment, October 15th through December 7th. This is for prescription drug coverage, whether that be through an Advantage plan or through a Medicare prescription drug plan, okay? This does not include Medigap policies. A lot of people think Medigap policies have an annual enrollment period. Here in Texas, it does not. There are some states that allow it, but not here in Texas, and I think they are working on that. So maybe it'll come up in a few years. The plan changes take effect January 1st, and this gives you ways that you can review plans and compare plans. There's also a 5-star enrollment period. So if you're looking to change plans and you're not happy with the Advantage plan that you have or prescription drug plan, if a plan has 5 stars, you can enroll in that anytime, and you can do that once per year.
So I'm retired, if I retire, say in July 1st, and I've signed up several weeks before for Medicare, I got the paperwork for my work, and they know it starts immediately, right? It doesn't?
They have to accept you.
Oh, okay.
I mean,
Just scared me.
I say that, no, it has to be approved.
Okay,
So they're gonna go through their process, making sure that you were covered ever since you were 65 and all of that before, it's approved.
but I just like, October 1st is normal sign-up day, and I don't wanna retire on October 1st.
No, that's if somebody already has Medicare.
Right.
Yes,
Okay.
that's if somebody already has Medicare, and so therefore, people get that confused. You know, they hear October 15th through December 7th, okay, that's my time to sign up. No, if you do not have Medicare yet, then that's not your time.
You're gonna leave us your email, right?
No.
You got her number.
No, I'll have to refer you to my assistant.
Hey, Vicky, you should have taken the picture of the slide with her phone number on it while it was up.
It'll come up,
It's gone.
it'll come up
She'll
again.
get it.
Hey Vicki,
And-
just a quick question, are we posting these presentations on the PCBC website to
Yes.
download?
Yes.
Okay.
All your questions recorded right here.
Also, on the back of the Medicare and You handbook, if you have that, there's a state number. So if you have this state number, you put in your zip code, then it's routed to the appropriate agency. Again, we don't cover Dallas and Tarrant, but if you call me, I will answer your questions. I will. Like I said, we also work with the Texas Senior Medicare Patrol because it goes hand in hand. You know, we're trying to help people reduce fraud and abuse, and we have to tell them about all the different types of fraud that takes place. There are homeowner fraud, there's homeowner fraud, there is romance scam frauds, there is debit card, credit card fraud. There's so many different things.
Social media.
Oh, definitely. And the Senior Medicare Patrol provides presentations on that. We do a monthly midweek Medicare. We do a Medicare topic, Senior Medicare Patrol does a fraud topic. And those are actually on YouTube if you wanted to go in and look at those. Now, we do have several presentations coming up. One on mental health first aid. That is April 7th. And like I said, you will get a copy of the presentation so that if you want to sign up for that, you're welcome to. And we do have a few publications over there on mental health if someone is needing that publication. And if I don't have enough, you can reach out to me and we will get one to you. The midweek Medicare that we're doing next week, April 9th, will be on complaints, grievances, and beneficiary resources. And then government imposter scams is what the Senior Medicare Patrol will be doing. And that is it for me. I thank you for your time, and if we have any additional